And what was the surgery and how is your experiences? Your name and everything.
I am V. Nagaratnam, 70 years old, and I was able to walk, and I have done walking and all comfortably up to the day of surgery, but so much of wobbling it was there.
She was having actually duck-like walking, which continued for a long period. At the time
around
of
15 years.
At the time of walking also actually, when she stands just for 10 minutes, she used to experience severe pain. So, with this gait walk and all, she was not comfortable. And we have consulted actually Dr. Sharath. My niece got operated actually with Dr. Sharath, and she is very comfortable. Looking at her case history, we are very much convinced, and we have contacted Dr. Sharath and we took appointment. We came for just as an outpatient for consultation. Then he posted my wife for surgery on 20th July. Today it is 20th September. After 2 months, I should say that she is absolutely normal. She is free from the pain. She is walking very comfortably, and she started actually having that progress right from the almost first 7th day of her this thing. From the date of operation itself, she was very comfortable. She started actually taking her bath on her own, not depending upon anybody, and she started going to the bathroom. And for all nature calls and all, she was not depending upon anybody from the second day itself.
Second day.
So what about climbing stairs?
Climbing stairs I am doing.
You are doing.
Yeah.
Climbing stairs and getting down.
And
But regularly I am not doing.
You are not.
Weekly once.
How much time you can sit like this on the chair? You can sit
So,
for 1-2 hours, no
1-2
problem.
hours, no problem.
Oh.
But immediately after
When you get
getting
up or when you go in car and when you get down, you have
yes,
some pain. You have
some pain is
stiffness.
there. Stiffness is
Always
there.
after knee
Even
replacement.
normal patients.
No, but after knee replacement, many patients, this is a common problem. When they are not moving their knee, after some period of time, when they start to move it, it will have stiffness for some time. When you continue to move and walk and do, it will be okay. It will get free. Relaxed.
That I observed.
But this happens for first 3 months to 4 months. This is what my observation. And even many literature and other things suggest that initial few months you will have stiffness.
Yeah.
So these people behave in different way.
Yeah.
Each person's recovery is little different. But more or less it is same, but little minor differences. And how many days did you take physiotherapy?
1 month, sir.
1 month. And now you are doing exercises. How much duration?
Almost 1.5 hour
You are doing.
exercises.
And distance wise, how much you can walk in a day now?
40 minutes I am walking.
You are walking. And admission in the hospital for how many days?
3 days.
4 days. 4 days.
Tuesday I got
Including one
admitted.
day before surgery.
Yeah.
And the day of surgery, I did both sides simultaneously.
Wednesday she got Tuesday she got admitted. Wednesday was the surgery. She got discharged on Saturday.
4 or 5 days only.
From the date of surgery, if you take it, hardly 4 days.
4 days.
Both legs
Both
at a
legs.
time.
So, what you want to give any message to our audience? What message you are giving?
Definitely with the problem she got admitted, I should say that there is a remarkable change and progress in the patient, that's my wife. And definitely it's a wonderful this thing that the surgeon has done. See, physiotherapists may say that you will have to do physiotherapy, this and that. Finally, they would be able to do physiotherapy only when the surgery part of it is okay. When surgery part it is okay, only naturally they will be able to go ahead with the physiotherapy. Otherwise, physiotherapy, they won't be able to do it at all. So that way...
Yeah, that's a very right way of thinking because the position of the implant, the balancing of the knee is very important for outcome of the surgery. Also physiotherapy, but before that the surgical part.
Yeah.
So
we
that's
are extremely happy.
Thank you for your.
Yeah, we are
good,
extremely happy with the surgery, and definitely we recommend 100%, not 200% actually.
My daughter and son also say the same daily. He is a miraculous surgeon actually.
A satisfied patient is a very good this thing for going for this surgeon. See, my niece got admitted, so she is wonderful actually. She has improved very well.
That is the.
So by looking at the patient only naturally,
True.
we
How much ever these type of videos or ads or any websites you check,
yeah.
only 90% of the patients come from some other patient telling them,
Yeah.
you please go to this person.
Yeah.
That's the only thing all the time.
We are not referred anybody actually other than
true.
satisfied patient. That's why I put
Absolutely.
it
This is
satisfied.
In bringing it and the lunges, you know, you must
Yes,
be
you
like.
lunges, okay.
You want me to continue on this?
You continue all the exercises. Right now, I think you should. You don't have to call anyone to help you.
Uh-huh,
You are
no,
yourself. You are
I am-
able to.
I'm
Like
doing.
in a day, you walk for 1 kilometer. 1 kilometer.
Minimum.
You will walk. Okay, you continue your exercises and
40 days walking is
and after 3 months, I will ask you to come again.
Because it is something like manual treadmill, sir. Like the steps and all.
Yeah, that is.
See, so thank you so
Thank
much,
you very
doctor.
much,
You have
for
done a
your,
wonderful job. We are
excellent,
extremely happy actually the way my wife is progressing.
Thank you very
And
much.
we wish you a
and that hurdle crossing also, yeah.
You can do. You can do.
Glasses we can at a distance. He wanted me to lift the leg and
Yeah, cross. Yeah, do
Like
those
that.
exercises. Yeah. Okay, thank you very much.
Thank you.
Thanks.